Medical professionals of Reddit, what mistake have you made in your medical career that, because of the outcome, you've never forgotten? Serious. I worked as an au porter for a number of years to help me through school. I was cleaning up after an operation on an inmate who was Hep C and HIV+, and I was working quickly and recklessly. I stuffed the blue matting and used aprons into the garbage, and as I pulled up from the garbage, blood was pouring from my hand. Unseen and unknown to me, a doc or nurse had left a scalpel in the blue matting. It was so sharp that when it cut me, I didn't even feel it, but I was bleeding profusely. The nurses and docs jumped on it right away, cleaned and prepped my cut and got me on special meds right away. I had to get shots and checkups regularly for the next year. Luckily, I was okay. What I learned: work slowly and or carefully, especially in high risk situations. Complacency is your enemy. My heart raced after your first paragraph. It's also scary to think the people cleaning up are in a rush. I do HIV testing, and once I showed up to work super tired because I couldn't sleep the night before. This guy comes in for a test, we go through the pre-counseling, and then I tell him to step out for a few minutes while the results come up. Once he comes back to get his results, I tell him to take a sit, and the first thing that came out of my mouth was, "Your results are positive," and then I saw the look on his face, and that's when I realized I fricked up. I then said, "Oh no, I meant to say negative." I almost gave the guy a heart attack. Better this way than reversed. This is something a little narrower to my field than a lot of these. I work in palliative care, and in the fall I sent a patient home to see if he could die there instead of in hospital. We weren't very hopeful, but thought it would be worth a try. To no one's great surprise, even his and his wife's, he ended up coming back a couple of days later for whatever reason. I readmitted him. Since I knew him, I knew he wanted to be a DNR, do not resuscitate. I wrote it on my note, but I didn't fill out the hospital paperwork. The next day, I got to work to discover he'd been coded and was on a ventilator in the ICU. Instead of passing peacefully, his wife had to make the decision to turn off life support. My entire job at the end of life is to ensure as good a death as I can. And in one simple omission, I ed that up royally. Dang man, that's rough. This is why I make sure to keep a full copy of my DNR on record with the local hospitals, a hard copy in the car, and at least one electronic copy. Pharmacy technician here. I once was much too stressed and I was rushing. Instead of prednisone 5mg, I used prednisone 50mg. The pharmacist checked it and didn't catch it, but I realized when I was putting my stock bottles away. Luckily it hadn't gone out yet, so I fixed the mistake and vowed to be 100% dedicated to one task at a time. A few months later somebody made the exact same mistake but did not catch it, and the patient ended up in the hospital for a few months. Prednisone is a steroid. I was a hospice nurse for 10 years. I admitted a patient with cancer who had intractable bone pain, with what I expected to be a week or two before he died, based on my assessment. In his case, the only medication that gave him any relief was morphine. His wife did a great job taking care of him and giving him his meds as we planned. It was very effective and he was comfortable. As he came closer to his death he was sleeping more, which is normal and expected, and a daughter flew in to be with him at the end. She went ape crap that daddy was on morphine and raised so much heck that his wife freaked out and caved to her demands, revoked hospice and called the ambulance. When he got to the hospital, the daughter told them that he had taken too much morphine and the room doctor gave him Narcan. He came out of it screaming in pain, and didn't stop. He stayed in the hospital until he died, and he really suffered. It's been years since this happened and it's still the worst nightmare of my nursing career. There really wasn't anything I could have done because I spent a lot of time teaching his wife what to do and what to expect, but I still feel bad about it. Far too often patients' families do what they want for end-of-life care, not actually what the patient would want. I am a nuclear medicine technologist working in a PET department. I deal mostly with cancer patients. Prior to exams, I'll ask the patients why they are having the test done and for any other vital information. One day, a female patient told me she found a lump, had a mammogram, a biopsy, and it turned out to be stage 4 invasive ductal breast cancer. Having confirmed the information I had on my sheet with the patient, I made the mistake of saying, "Sounds good." To which he replied, "No, it's actually pretty freaking terrible," and she broke down in tears. I will never say sounds good again when a patient tells me his or her diagnosis. I'm a lab tech and used to work in histology when I was new. I got a skin biopsy specimen and that day I was embedding, basically putting the fixed tissue into wax so it could be mounted on a cutting block to slice 3 micrometer sections for staining. It's very important what side you place down, based on how it was cut out of the body. Well, I messed up and placed it sideways instead of down. The person cutting the tissue couldn't tell and ended up cutting through the tissue. This was a problem because the patient had skin cancer and they were looking at how far it had spread. Since it was cut too deep, they couldn't see the edges anymore. This means the doctor had to cut a bigger piece of skin off to be sure they got it all. That's when I found out it was a skin biopsy from the patient's nose. This patient had to have a bigger, potentially unnecessary, piece of skin from his face cut off because of me. I was horrified and learned my lesson that day on how important it is to be certain of embedding technique. Med student here. A few years ago, when I was working as a medical assistant in an interventional pain management clinic, I was asked by the doctor to place a grounding pad, a sticky pad like they use for EKGs, on the patient's leg during a radiofrequency (RF) nerve ablation procedure. The patient had some lotion or something on her leg that was keeping the pad from sticking properly, but it seemed to be mostly well attached and I didn't want to hold up the procedure to get another pad or clean off the patient's leg. The pad ended up partially coming off right as the high voltage RF was being applied, causing a small burn on her leg. There was no lasting damage done and the patient was very understanding, but I still felt horrible. It was the first time I had caused harm to a patient, and it could easily have been avoided had I just spoken up. Now I never hesitate to say something if I have even a slight feeling that something is off. Nothing is more important than a patient's well-being. 16 years ago when I was a medic in the military, this one Marine who came in for physical therapy seemed overly depressed, more so than usual. He had bad nerve damage, amongst other injuries, where he could touch his leg and it felt like someone was touching him in the back. I was more focused on the therapy that day and was excited he was making progress. He didn't seem happy about the progress and made a comment about how it won't matter. I also recalled when he left I said I would see him next week and he didn't say anything and just left. He hung himself over the weekend. I still wonder if I had paid attention to his comments and not had dismissed them as him having a bad day, maybe he'd still be alive. Then again, mental health issues were still seen as a defect when I was in, so would he even have accepted mental health treatment? Sorry for rambling, but I now pay attention to friends' mood swings and signs of depression. Just wish I had done the same 16 years ago though. Once as a tired medical resident I was called to the ER to admit someone at like 3 AM. This bonehead had gallbladder removal a week ago and now had a surgical site wound infection. I asked if they'd taken their post-op antibiotics they were prescribed, and they weren't sure. I was getting more and more frustrated with this dumbass preventing my sleep when I decided to use a pregnant pause interview technique and just shut up. This usually results in either awkward silence and the patient saying UHHWTF doc, or awkward silence followed by some useful deep revelation. In this case the guy hung his head low, looked at his feet through unfocused eyes, started to sniffle while his halting voice cracked, "I can't read, never could, didn't know the instructions they wrote down for me and didn't know I had medicine to buy. I didn't ask them because I was embarrassed." Illiteracy haunts rural and urban places in most countries. Those folks aren't dreading this, and they depend on our patience and understanding, and acceptance, to detect and bridge that vast communication gap. That's what stuck with me. I once said, "Wow, that's really cool," after listening to his LVAD for the first time. That's a left ventricular assist device for heart failure that continuously circulates in a parallel circuit to the left ventricle to keep the patient alive. He joked, "It's really cool if it's not inside you," and I said, "Oh right, I meant the sound and the technology, but yes, I'm sorry about that." He was a jokester, very happy, but it did make me think twice before opening my mouth again in certain situations. It was a dang cool piece of technology, but the patient's interpretation of your words is paramount. When I was a new paramedic, we were called to a house for an unknown problem. We arrived and found our patient unresponsive but breathing on a bed. A friend of his found him after he hadn't returned his phone calls. They were going out to do something that day, and he found it weird that the guy hadn't called him yet. so he had gone to his house to investigate. The patient didn't have any pill bottles laying around, and his friend didn't know anything about the patient's medical history. So, I loaded him up into the ambulance and started transporting to the hospital. Started an IV, did an ECG, drew blood work, the whole workup, get him to the hospital, and the first thing the nurse asked was what was his blood sugar level. Oops, forgot to check it. Turns out, it was incredibly low, which is completely treatable, and probably wouldn't have required transporting him to the hospital if corrected on scene. Every patient gets a blood sugar check now. A, airway, B, breathing, C, circulation, D, EFG. Don't ever forget glucose. If you work as a physician in any acute setting, don't dress up for Halloween. My supervising resident had to tell a family that their daughter had cancer while dressed as Cat in the Hat. Respectfully, he took off the hat. Myself personally, I lucked out. Considered starting medication for a young woman. Gave her the script. 4 days later she found out she was pregnant. My prescription has clear teratogenic effects. I was sweating bullets. Fortunately, she decided against taking the prescription and I found out from our pharmacist that she didn't fill it. I left a message, don't take it, and she called me back thanking me for being such a great doctor. Beta HCG for every goddamned female within shouting distance of fertility. Beta HCG equals pregnancy test. I googled it so you won't have to. RN here. I was taking care of a man with liver failure who was not a candidate for a transplant. He waxed and waned, meaning he vacillated between complete brain function and confusion. I brought him his pills and made some small talk. We chatted a little bit before I handed him a cup to drink from on his bedside table. He tossed the pills in his mouth and took a gulp from the cup. He looked at me and said that pee in a really matter-of-fact way. I checked the cup. It was. While he was confused, he must have gone in the cup instead of his urinal and then forgotten about it. Now I always check before handing people cups from their bedside tables. This isn't so much a medical error, but a time I feel that I failed my patient. I was on my first clinical rotation in a rural emergency room, and a woman came in with a miscarriage, her second one. While we were talking, she mentioned she was new to town, didn't know anyone, and her husband was away for the weekend. When we told her the diagnosis, her eyes became teary, and then we left to make arrangements. The doc didn't say he was sorry for her loss or comfort her in any way, which I instinctively wanted to do. When I went back in her room to give her appointment time, she was in pieces. It really gets me. The 5 seconds it would have taken me to say those words, put a hand on her shoulder, call someone, or just offer some tissues, anything, but I didn't do it. Instead, I let my fear of not knowing if I would be showing too much emotion or slowing down the doc stop me from being human. The silver lining is now I do what my gut tells me. I've soothed babies from exhausted parents, picked up crying family members off the floor, and even discussed comic book heroes with kids getting stitches because that's the kind of person I am, and doctor I want to become. I was still a new EMT and had a new paramedic as a partner. We got a call of a man with no pulse. We arrived and find a 350-ish pound man in the middle of a waterbed. No pulse. So the new paramedic did a quick look with the paddles and decided to shock. The shock creates a muscle spasm and set off a series of events which led to the patient being wedged between the waterbed mattress and frame. It was impossible for two of us to unwedge him, although there was a brief discussion of cutting the mattress and letting all the water out. Never shock someone you can't lift on a waterbed. Oh goodness, when I read shock and waterbed, I thought this was going to be an electrocution story.
Oh, hey. Don't mind me. I'm just working hard on the next Dude Man video. Hey, by the way, if you want more awesome content like this, you should check that channel out. What you should. You should want to watch more awesome content. Then head on over to Dude Man. I'm Lunar Steve and I'm the host over there. Go give it a look. I hope you like what you see.